Question 1. A behavior analyst is working with a client who frequently engages in screaming when they are asked to complete a task. The analyst hypothesizes that the screaming is occurring because the client does not want to do the task. This hypothesis is based on which function of behavior? A. Attention. B. Tangible. C. Escape. D. Automatic. Answer: C. Escape. This question is asking about the potential reason why the client is screaming, which is the function of the behavior. The scenario mentions the screaming happens when the client is asked to complete a task, and the analyst thinks it's because they does not want to do the task. This strongly suggests the behavior is happening to get away from or avoid the task, which is the definition of an escape function. Attention is about getting interaction. Tangible is about getting an item, and automatic is about self-stimulation or internal feelings, none of which fit this scenario, as well as escaping the task demand. So, if the behavior stops the demand, it's likely serving an escape function. Here's a tip. Think get out of jail free card when you hear escape. Question 2. Which of the following is a primary characteristic of a multiple baseline design? A. Reversal of the intervention to a baseline condition. B. Applying the intervention to different behaviors, settings, or subjects at different times. C. Comparing two or more interventions simultaneously. D. Measuring behavior only after the intervention has been implemented. Answer: B. Applying the intervention to different behaviors, settings, or subjects at different times. This question tests your knowledge of different experimental designs used in ABA to show that an intervention is what caused a change in behavior. A multiple baseline design is special because you collect data on several things, like behaviors, settings, or people, but only apply the intervention to one at a time, waiting to see a change before applying it to the next. This staggered start helps show that the intervention, not something else, is causing the change. Reversal designs involve taking the intervention away. Comparing interventions simultaneously is a multi-element design, and measuring only after intervention isn't a standard design characteristic. The key here is different times for the same intervention across different things. Remember, multiple baselines stagger the introduction of the intervention. Question 3. A BCBA is developing a skill acquisition program for a child learning to greet others. The program involves teaching the child to say hi when someone says hi to them. This is an example of teaching a behavior based on which operant? A. Manned. B. Tact. C. Echoic. D. Intraverbal. Answer: C. Echoic. This question asks about the specific type of verbal behavior being taught. The scenario describes the child learning to repeat or imitate the sound hi after someone else says hi. When someone says something and the learner repeats it, it's called an echoic. A manned is asking for something, like saying cookie because you want one. A tact is naming something, like saying cookie because you see one. And an intraverbal is a conversational response, like saying chocolate chip when someone says name a type of cookie. Since the child is imitating the sound they heard, it's an echoic. Think of an echo, it repeats the sound. Question 4. Which of the following best describes the primary purpose of conducting a functional behavior assessment, FBA? A. To determine a client's skill deficits. B. To identify the consequences that maintain a behavior. C. To design a system for collecting data. D. To find out what motivates a client. Answer: B. To identify the consequences that maintain a behavior. This question is asking about the main goal of a functional behavior assessment, FBA. While an FBA might indirectly inform you about skill deficits or help with data collection strategy, its core purpose is to understand why a behavior is happening. Specifically, what happens right after the behavior, the consequence, that makes it likely to happen again in the future. These consequences are what maintain the behavior, meaning they are the function. While understanding motivation, which relates to antecedents and consequences, is part of it, the most direct outcome of an FBA is identifying the maintaining consequence. An FBA looks at what happens before, antecedent, the behavior itself, and what happens after. Consequence, to figure out the pattern and the payoff for the behavior. The payoff is key. Question 5. Differential reinforcement involves A. Providing reinforcement only for desired behaviors and withholding it for undesired behaviors. B. Providing reinforcement every time a desired behavior occurs. C. Removing a stimulus following a behavior to decrease its future probability. D. Punishing an undesired behavior while ignoring a desired behavior. Answer. A. Providing reinforcement only for desired behaviors and withholding it for undesired behaviors. This question is about differential reinforcement, which is a common strategy to increase appropriate behaviors while decreasing challenging ones. The core idea is to reinforce, rewardee, the behavior you want to see and not reinforce, withhold the reward for, the behavior you don't want to see. This makes the desired behavior more likely and the undesired behavior less likely over time because it doesn't get the payoff. Option B describes continuous reinforcement, C describes negative punishment, and D describes punishing good behavior and ignoring bad, which is the opposite of what you do. Differential reinforcement is like saying, yes, you get the cookie for this, and no cookie for that. Question 6. A behavior analyst wants to measure how long a client engages in a specific behavior, such as playing appropriately with a toy. Which measurement method would be most appropriate? A. Frequency. B. Duration. C. Latency. D. Whole interval recording. Answer. B. Duration. This question asks for the best way to measure how long a behavior occurs. Duration is the measurement of the total time a behavior happens from start to finish. Frequency counts how many times a behavior happens. Latency measures the time from a cue to the start of the behavior, and whole interval recording checks if the behavior happened throughout an entire interval. Since the goal is to measure the length of time the client plays appropriately, duration is the correct choice. Think of a stopwatch. You use it to measure duration. Question 7. Which of the following is an example of a conditioned reinforcer? A. Food. B. Water. C. Praise. D. Shelter. Answer. C. Praise. This question is about distinguishing between different types of reinforcers. A primary or unconditioned reinforcer is something that is naturally reinforcing because it's essential for survival or just naturally pleasurable, like food, water, or warmth. You don't have to learn that these are good. A conditioned or secondary reinforcer is something that becomes reinforcing because it has been paired with a primary reinforcer or other conditioned reinforcers. Praise, great job, doesn't naturally keep you alive, but it becomes rewarding because it's often paired with good things like smiles, access to fun activities, or getting attention. Food, water, and shelter are primary reinforcers. Conditioned reinforcers get their power from being linked to other good things. Question 8. A client consistently throws their toys. The BCBA implements an intervention where every time the client throws a toy, a preferred toy is immediately removed for a brief period. This intervention is an example of A. Response cost. B. Timeout. C. Extinction. D. Negative reinforcement. Answer. A. Response cost. This question describes a procedure aimed at decreasing behavior by taking something away. Specifically, it involves the removal of a preferred item, the toy, contingent on the response, throwing the toy, which decreases the future probability of that response. This is the definition of response cost, a form of negative punishment where a specific amount of a reinforcer is removed. Timeout involves removing the individual from a reinforcing environment. Extinction involves withholding the maintaining reinforcer for the behavior, and negative reinforcement involves removing an aversive stimulus to increase a behavior. Taking away a toy when they throw it is the classic response cost scenario. Think of getting a cost for your response. Something good is taken away. Question 9. When preparing for a session, a BCBA ensures that all necessary materials are ready and the environment is free from distractions. This is an example of manipulating which part of the ABC contingency. A. Antecedent. B. Behavior. C. Consequence. D. Function. Answer. A. Antecedent. This question is about the ABC model, which stands for antecedent behavior consequence. The A is what happens before the behavior, the B is the behavior itself, and the C is what happens after the behavior. The scenario talks about preparing materials and setting up the environment before the session starts and before any specific behavior occurs. These are things that come before the target behavior and can influence whether it happens, making them antecedents. Consequences happen after the behavior, and function is the reason why the behavior occurs, based on the consequence. Setting the stage is all about the antecedent. Question 10. Which of the following is an example of stimulus generalization? A. A child is taught to say dog when they see a golden retriever and later says dog when they see a poodle they've never seen before. B. A child is taught to say dog when they see a golden retriever and only says dog when they see that specific golden retriever. C. A child is taught to say dog when they see a picture of a golden retriever and says cat when they see a picture of a poodle. D. A child is taught to say dog when they see a golden retriever and asks for a dog cookie when they see a golden retriever. Answer. A. A child is taught to say dog when they see a golden retriever and later says dog when they see a poodle they've never seen before. This question asks about stimulus generalization. Generalization means the behavior happens in response to stimuli, things in the environment, that are similar to the original stimulus where the behavior was learned, even though they aren't exactly the same. In option A, the child learned to say dog for one type of dog, golden retriever, but then says it for a different type of dog, poodle. The poodle is a similar stimulus, and the same response, dog, occurs. Option B is stimulus discrimination, responding only to the trained stimulus. Option C shows a different response to a different stimulus. Option D involves a different type of verbal behavior, mandates, tact. Generalization is seeing the behavior spread to new, similar situations or items. Think of it as the behavior generalizing to new stimuli. Question 11. An operational definition of a behavior should be A. Long and complex, including the presumed function of the behavior. B. Subjective and open to interpretation by different observers. C. Clear, concise, and measurable, describing what the behavior looks and sounds like. D. Focused only on the internal feelings of the person performing the behavior. Answer. C. Clear, concise, and measurable, describing what the behavior looks and sounds like. This question is about defining a behavior so that everyone collecting data knows exactly what they are looking for. An operational definition must be objective and measurable. This means it describes the behavior in terms of what you can see and hear, leaving no room for guesswork or subjective opinions. It should be so clear that two different people watching the same person would agree on whether or not the behavior happened. Option A is incorrect because it should be concise and avoid assumptions about function. Option B is the opposite of what's needed. It must be objective. Option D is impossible to measure objectively. We can't directly observe feelings. An operational definition is like giving someone a recipe for identifying the behavior, precise and repeatable. Question 12. A BCBA is training a parent to implement a praise program. The BCBA models giving praise enthusiastically, has the parent practice, and provides feedback. This training method is primarily an example of A. Behavioral contrast. B. Behavioral skills training. BST. C. Punishment. D. Shaping. Answer. B. Behavioral skills training. BST. This question describes a common way to teach new skills to people who will be implementing behavior plans, like parents or staff. Behavioral skills training. BST is a standard procedure used for this purpose. It typically involves 4 steps: telling the learner what to do, instructions; showing them what to do, modeling; having them practice, rehearsal; and giving them feedback on their practice. The scenario includes modeling, practice, and feedback, which are key components of BST. Behavioral contrast is about changes in behavior rate in one setting when consequences change in another. Punishment decreases behavior. Shaping involves reinforcing successive approximations of a behavior. BST is your go-to for teaching people how to do ABA procedures. Question 13. Which schedule of reinforcement is most likely to produce a high and steady rate of responding? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: B. Variable ratio, VR. This question asks about the different schedules of reinforcement and the pattern of behavior they produce. A variable ratio, VR, schedule provides reinforcement after an unpredictable number of responses. Because the learner doesn't know exactly when the reinforcement is coming, but knows it's based on how many times they respond, they tend to respond quickly and consistently to get to the next reinforcement. Fixed ratio creates a high rate, but with pauses after reinforcement. Fixed interval and variable interval schedules are based on time, not the number of responses, and generally produce lower rates of responding, often with pauses, FI, or a steady but moderate rate, VI. Think of a slot machine. You never know exactly how many pulls it will take, so people pull fast and consistently, VR. Question 14. When creating a task analysis, the behavior analyst is essentially breaking down a complex skill into A. Its potential functions. B. Smaller, manageable steps. C. The antecedents that trigger it. D. The consequences that maintain it. Answer: B. Smaller, manageable steps. This question is about a task analysis. A task analysis is a procedure where a complex skill, like washing hands or making a sandwich, is broken down into a series of smaller, simpler steps that can be taught one by one. It's like creating a step-by-step instruction manual for a behavior. The purpose is to make learning a complicated skill easier by tackling it in pieces. The other options relate to understanding why a behavior happens, function, antecedents, consequences, not breaking down how to do a complex skill. Breaking down a task is all about listing the small steps required to complete it. Question 15. A client engages in hand flapping. The BCBA observes that this behavior occurs most often when the client is alone and there are no specific demands placed on them. The BCBA hypothesizes the function might be A. Attention. B. Tangible. C. Escape. D. Automatic. Answer: D. Automatic. This question asks about the potential function of a behavior based on the conditions under which it occurs. The key clues here are when the client is alone and no specific demands placed on them. This suggests the behavior isn't happening to get something from others, attention or tangible, or get away from something, escape, when a behavior occurs because of the internal sensation or feeling it provides to the individual. Without any obvious external consequence, it's often considered to have an automatic function. Hand flapping, stimming, or rocking can fall into this category. If the behavior happens even when no one else is around and nothing else is being asked, think automatic. Question 16. Which type of discontinuity in data on a graph is typically used to indicate a change in intervention or condition? A. Data point. B. Phase line. C. X-axis label. D. Y-axis label. Answer: B. Phase line. This question is about how graphs in ABA visually represent changes in the conditions under which data is collected. A phase line is a vertical line drawn on a graph between data points that indicates a change in the experimental condition, such as moving from baseline to intervention or from one intervention phase to another. Data points represent individual measurements. The x-axis typically represents time, sessions, days, and the y-axis represents the measurement of the behavior. The phase line is the visual marker on the graph that screams, "Something changed here." Question 17. A teacher praises a student immediately after they raise their hand to ask a question. The student increases how often they raise their hand in class. Praise served as A. Punisher. B. Negative reinforcer. C. Positive reinforcer. D. Discriminative stimulus. Answer: C. Positive reinforcer. This question describes a scenario where a consequence is added following a behavior, and that behavior increases in the future. This is the definition of reinforcement. Specifically, because something was added, praise, to increase the behavior, raising handy, it is positive reinforcement. Punishment decreases behavior. Negative reinforcement involves removing something aversive to increase behavior. A discriminative stimulus is something that signals that reinforcement is available for a specific behavior. It doesn't follow the behavior. If adding something makes the behavior happen more often, it's positive reinforcement. Question 18. Which term refers to the gradual process of changing a behavior by reinforcing successive approximations of the target behavior? A. Fading. B. Prompting. C. Chaining. D. Shaping. Answer: D. Shaping. This question asks about a specific procedure used to teach new behaviors that the learner doesn't currently perform perfectly. Shaping involves starting by reinforcing any behavior that is similar to the target behavior, and then gradually only reinforcing closer and closer versions, successive approximations, until the learner performs the full target behavior. Fading involves gradually reducing prompts. Prompting is giving cues to help the learner respond correctly. Chaining links together a sequence of steps to form a complex behavior. Shaping is how you get a behavior that doesn't exist yet by reinforcing small steps towards it. Think of shaping clay. You gradually mold it into the final form. Question 19. A client is learning to identify colors. When presented with a red card, the therapist says, "Touch red," and points to the red card. The pointing is an example of A. Verbal prompt. B. Gestural prompt. C. Physical prompt. D. Visual prompt. Answer: B. Gestural prompt. This question is about prompts, which are cues used to help a learner perform a desired behavior. The therapist is pointing to the correct answer. Pointing or making gestures is a gestural prompt. A verbal prompt involves saying something, like touch red. A physical prompt involves physically guiding the learner's movement. A visual prompt might involve showing a picture or written instruction. Since the therapist is using a gesture, pointing, to help the client respond, it's a gestural prompt. Prompts help the learner get it right, and this one uses a gesture. Question 20. Establishing operations, EOs, are environmental events that A. Signal that reinforcement is available for a behavior. B. Alter the effectiveness of a reinforcer and the frequency of behaviors that have been reinforced by that reinforcer. C. Occur immediately after a behavior and increase its future probability. D. Occur immediately after a behavior and decrease its future probability. Answer: B. Alter the effectiveness of a reinforcer and the frequency of behaviors that have been reinforced by that reinforcer. This question asks about the effect of establishing operations, EOs, also known as motivating operations, MOs. EOs are things that happen before a behavior that change how much you want a certain consequence, and because of that, change how likely you are to do behaviors that have gotten you that consequence in the past. For example, being really thirsty, EO, makes water more reinforcing and makes you more likely to ask for water or go to the water fountain. Option A describes a discriminative stimulus, SD. Options C and D describe consequences, reinforcement, and punishment. EOs are all about motivation. They make something more or less valuable as a reinforcer. Question 21. When conducting discontinuous measurement, such as partial interval recording, the data recorded represents A. The exact frequency of the behavior. B. The total duration of the behavior. C. An estimate of the occurrence or non-occurrence of the behavior within intervals. D. The latency of the behavior. Answer: C. An estimate of the occurrence or non-occurrence of the behavior within intervals. This question is about discontinuous measurement methods, which are ways to estimate behavior occurrence without measuring every single instance or the exact length of time. Methods like partial interval, whole interval, and momentary time sampling involve dividing the observation time into intervals and recording whether the behavior happened at all during the interval. Partial, throughout the entire interval. Whole, or at the very end of the interval. Momentary. These methods provide an estimate of how often or how long a behavior occurs, rather than an exact count, frequency, or exact time, duration, latency. They are used when continuous measurement is too difficult. Discontinuous measurement gives you a snapshot, not the whole movie. Question 22. Which principle states that a higher probability behavior can be used to reinforce a lower probability behavior? A. Extinction. B. Premack principle. C. Punishment. D. Spontaneous recovery. Answer: B. Premack principle. This question describes the Premack principle, often stated as first, do the less preferred activity, then do the more preferred activity. It uses access to a high probability behavior, something the person is more likely to do, as a reward for completing a lower probability behavior, something they are less likely to do. For example, if a child is more likely to play video games than do homework, you can use the Premack principle by saying, first homework, then video games. Extinction removes reinforcement. Punishment decreases behavior by adding something aversive or removing something preferred. Spontaneous recovery is the reappearance of a behavior after extinction. The Premack principle is all about using preferred activities as motivators for less preferred ones. Question 23. A BCBA is teaching a client to tie their shoes using backward chaining. Where does the instruction begin? A. With the first step of tying the shoes. B. With the last step of tying the shoes. C. With the middle step of tying the shoes. D. By teaching all steps simultaneously. Answer: B. With the last step of tying the shoes. This question is about backward chaining, which is a method for teaching complex skills that involve a sequence of steps. A chain. In backward chaining, the therapist completes all steps of the task except the last one, prompts the learner to do the last step, and reinforces them when they complete it. Once the learner masters the last step, the therapist completes all steps except the last two, prompts the learner to do the second to last and last step, and reinforces them. This continues backward through the chain until the learner can perform all steps from beginning to end. The instruction starts with the last step. Forward chaining starts with the first step. Backward chaining lets the learner finish the task and get the natural reinforcer, like having shoes tied. Question 24. A client previously received attention for yelling. A BCBA implements an extinction procedure by no longer providing attention when the client yells. Initially, the client's yelling significantly increases before decreasing. This temporary increase in behavior is known as A. Spontaneous recovery. B. Behavioral contrast. C. Extinction burst. D. Punishment. Answer: C. Extinction burst. This question describes a common phenomenon that happens when you start an extinction procedure. An extinction burst is a temporary increase in the frequency, intensity, or variability of the behavior that is being put on extinction. It's like the behavior is trying harder to get the reinforcement that used to be there. In this case, the yelling increases when attention is withheld because the client is trying to get the attention they used to receive. Spontaneous recovery is the reappearance of the behavior after it has been extinguished. Behavioral contrast is about behavior changing in one setting due to changes in another. Punishment decreases behavior. The extinction burst is a sign that your extinction procedure is having an effect. Question 25. A BCBA is collecting data on a client's hitting behavior. They record every instance of hitting that occurs during the observation period. This is an example of using which measurement method? A. Partial interval recording. B. Momentary time sampling. C. Frequency. D. Duration. Answer C. Frequency. This question asks about the measurement method used when you count every single time a behavior happens. Frequency, also called rate when divided by time, is simply a count of how many occurrences of the behavior happen during a specific period. Partial interval, momentary time sampling, and whole interval recording are discontinuous methods that estimate occurrence within intervals. Duration measures how long the behavior lasts. Since the BCBA is recording every instance, they are measuring the frequency. Counting clicks on a counter is frequency measurement. Question 26. A discriminative stimulus, SD, is a stimulus in the presence of which A. A behavior is less likely to be reinforced. B. Reinforcement is withheld for a behavior. C. A behavior is more likely to occur because it has been reinforced in its presence. D. A behavior is less likely to occur because it has been punished in its presence. Answer C. A behavior is more likely to occur because it has been reinforced in its presence. This question defines a discriminative stimulus, SD. And SD is like a signal or a cue that tells you that if you perform a specific behavior right now, you are likely to get reinforced. For example, a stop sign. SD signals that pressing the brake is likely to avoid a ticket. Reinforcement. A teacher standing at the front of the room, SD, might signal that raising your hand and asking a question is likely to get attention. Reinforcement. Option A and B describe an S delta, S, which signals that reinforcement is not available. Option describes a stimulus that might signal punishment. And EST sets the occasion for reinforcement. Think of SED as standing for signal for availability of reinforcement. Question 27. Which ethical principle requires behavior analysts to operate within their scope of competence? A. Beneficence. B. Fidelity. C. Integrity. D. Professional and ethical behavior. Answer D. Professional and ethical behavior. This question relates to the ethical code for behavior analysts, the principle of professional and ethical behavior, part of Section 1 of the BACB Ethics Code, explicitly states that behavior analysts practice within their competence and do not misrepresent their credentials. Beneficence is about maximizing benefits and minimizing harm. Fidelity in other professions is about faithfulness to commitments, though not a distinct principal name in the BACB code. Integrity is about being truthful and honest. Working within your area of expertise is a core part of being a responsible professional. Don't try to do things you aren't trained or qualified to do. Question 28. A graph showing a steady increase in the rate of a behavior over time is described as having a ascending trend, B. Descending trend, C. Stable trend, D. Variable trend. Answer A. Ascending trend. This question asks about describing the overall direction of the data path on a graph. If the data points are generally moving upward over time, indicating the behavior is increasing, the graph shows an ascending trend. A descending trend shows the behavior decreasing. A stable trend shows the behavior remaining relatively consistent over time. A variable trend shows the data points fluctuating significantly without a clear upward or downward direction. Upward is ascending, downward is descending, flat is stable, and all over the place is variable. Question 29. A token economy is a system where generalized conditioned reinforcers, tokens, are earned for specific behaviors and later exchanged for A. Other tokens, B. Backup reinforcers, C. Punishers, D. Discriminative stimuli. Answer B. Backup reinforcers. This question defines a key component of a token economy. In this system, learners earn tokens, like points, stickers, or chips, which are generalized conditioned reinforcers because they can be exchanged for many different things. The important part is what the tokens are traded for. These are called backup reinforcers. Backup reinforcers are the actual items, activities, or privileges that the learner really wants and that give the tokens their value. Tokens aren't typically exchanged for more tokens, A. Punishers, C. or discriminative stimuli, D. Tokens get their power because they can be traded for desired things, the backup reinforcers. Question 30. Which term refers to the process of breaking down a complex skill into smaller teachable steps? A. Chaining. B. Shaping. C. Task analysis. D. Prompting. Answer C. Task analysis. This question is a repeat of a previous concept, but phrased differently, testing if you recognize the procedure. The process of taking a complex skill and listing all the individual, smaller steps in order is called a task analysis. This analysis is then used as the basis for teaching the skill using chaining procedures, like forward or backward chaining. Shaping reinforces successive approximations of a single behavior, not a sequence of steps. Prompting is giving cues. A task analysis is the plan or the list of steps. Remember, you do a task analysis before you start chaining. Question 31. The ability of a conditioned stimulus, CS, to elicit a conditioned response, CR, is developed through which process? A. Operant conditioning. B. Classical conditioning. C. Observational learning. D. Punishment. Answer B. Classical conditioning. This question is about classical conditioning, which is also known as Pavlovian conditioning. This type of learning happens when a neutral stimulus is repeatedly paired with an unconditioned stimulus that naturally elicits a response. Eventually, the neutral stimulus becomes a conditioned stimulus and can by itself elicit a conditioned response. Think of Pavlov's dogs. The bell, neutral stimulus, then CS, was paired with food, unconditioned stimulus, UCS, which naturally caused salivation. Unconditioned response, UCR. Eventually, the bell alone, CS, caused salivation, conditioned response, CR. Operant conditioning is about learning through consequences. Observational learning is learning by watching others. Punishment decreases behavior. Classical conditioning is all about learning associations between stimuli. Question 32. When is it generally most appropriate to use continuous measurement methods, like frequency or duration, versus discontinuous measurement methods, like interval recording? A. When the behavior occurs at a very high rate. B. When you need an exact count or duration of the behavior. C. When the behavior is difficult to observe constantly. D. When you have limited time for data collection. Answer B. When you need an exact count or duration of the behavior. This question contrasts continuous and discontinuous measurement. Continuous measurement methods, frequency, duration, latency, capture every instance or the exact length of a behavior. This is necessary when precision is important and you need to know the true rate or total time the behavior occurs. Discontinuous methods, interval recording, time sampling, provide estimates and are often used when behaviors occur at high rates, are hard to observe constantly, or when time is limited, as they are easier to implement. However, discontinuous methods inherently provide less accurate data. If you need precise data, use continuous measurement. Continuous data gives you the most accurate picture. Question 33. A prompt should be delivered. A. After the learner makes an incorrect response. B. As the learner is beginning to perform the target behavior. C. Before or during the behavior to make a correct response more likely. D. Only when the learner fails to respond. Answer C. Before or during the behavior to make a correct response more likely. This question is about the timing of prompts. Prompts are designed to help the learner make a correct response. To do this, they must be delivered before the learner has a chance to make an error, or as they are performing the behavior, guiding them towards the correct response. Delivering a prompt after an incorrect response would be more like feedback or error correction, not prompting the response itself. Delivering only after failure can lead to the learner waiting for the prompt. The goal of a prompt is to evoke the correct behavior in the presence of the est, making a correct response more probable before the behavior occurs or as it is happening. Prompts are like training wheels. They help you succeed from the start. Question 34. Which dimension of behavior refers to the force or intensity of a behavior? A. Frequency. B. Latency. C. Magnitude. D. Duration. Answer C. Magnitude. This question asks about the different dimensions of behavior that can be measured. Frequency is the count, latency is the time from cue to start, and duration is the length of time. Magnitude, or intensity, refers to how strong or forceful the behavior is. For example, the loudness of a scream, the force of a punch, or the pressure used when writing could all be measured by magnitude. Think of a magnitude scale for earthquakes. It measures how intense it is. Question 35. A client engages in property destruction. A BCBA conducts an FBA and determines the function is escape from difficult tasks. Which intervention strategy is most directly aligned with the FBA results? A. Provide attention every time the client destroys property. B. Remove the client's favorite toy contingent on property destruction. C. Teach the client to ask for a break from difficult tasks and reinforce this request. D. Ignore all instances of property destruction. Answer C. Teach the client to ask for a break from difficult tasks and reinforce this request. This question is about selecting an intervention based on the determined function of a behavior. The FBA found the property destruction serves an escape function. The client does it to get away from difficult tasks. The most effective interventions based on FBA replace the challenging behavior with an alternative, appropriate behavior that serves the same function. Teaching the client to ask for a break is teaching an appropriate way to escape the difficult task, thus addressing the function. Option A provides attention, wrong function. Option B is a punishment procedure, might work, but doesn't teach a replacement behavior tied to the function. Option D is extinction. Wrong function's reinforcer being withheld. Function-based intervention teaches a better way to get the same outcome. Question 36. Which of the following is not a defining characteristic of behavior according to ABA? A. It is observable. B. It is measurable. C. It involves movement or action. D. It includes thoughts and feelings. Answer D. It includes thoughts and feelings. This question asks what doesn't fit the ABA definition of behavior. In ABA, behavior is defined as anything an organism does that is observable and measurable. This typically involves some form of movement or action. While thoughts and feelings are real experiences, they are private events that are not directly observable or measurable by another person, and therefore are not typically treated as behavior in the same way that hitting, speaking, or walking are for direct analysis and intervention. ABA focuses on what you can see and count. Question 37. A BCBA wants to measure the rate of tantrum behavior, which occurs frequently and for varying lengths of time. Which measurement method would be most appropriate for getting an accurate count? A. Duration. B. Frequency. C. Whole interval recording. D. Momentary time sampling. Answer B. Frequency. The question asks for the best way to get an accurate count of the behavior, even though it varies in length. Frequency is the direct count of occurrences. Duration measures how long it lasts. Whole interval recording would underestimate the frequency if tantrums started and stopped within an interval but didn't last the whole interval. Momentary time sampling would only capture tantrums happening at the exact moment of the interval check, also likely underestimating the count. To get an accurate count of how many times it happens, you need frequency. Even if they are different lengths, each time it starts is one instance for counting. Question 38. An intervention involves withholding the maintaining reinforcer for a previously reinforced behavior, resulting in a decrease in the future frequency of that behavior. This describes A. Positive reinforcement. B. Negative reinforcement. C. Punishment. D. Extinction. Answer D. Extinction. This question defines extinction. Extinction occurs when a behavior that was previously reinforced no longer receives that reinforcement, leading to a decrease in the behavior over time. For example, if a child used to get attention, reinforcement, for screaming behavior, and you stop giving attention, withholding the reinforcer, the screaming should decrease. Extinction. Reinforcement increases behavior. Punishment decreases behavior by adding an aversive stimulus or removing a preferred one, not by withholding the maintaining reinforcer. Extinction is about cutting off the behavior's payoff. Question 39. When teaching a new skill using reinforcement, it is generally best to start with which schedule of reinforcement to quickly establish the behavior? A. Variable ratio, VR. B. Fixed ratio, FR. C. Continuous reinforcement, CRF. D. Intermittent reinforcement. Answer: C. Continuous reinforcement, CRF. This question asks about the best reinforcement schedule for initially teaching a new behavior. Continuous reinforcement, CRF, means the behavior is reinforced every single time it occurs. This is the fastest way to get a new behavior started and make it strong initially, because the learner quickly learns that performing the behavior always leads to the reward. Once the behavior is established, you would switch to an intermittent schedule to make it more resistant to extinction. Intermittent reinforcement is a general term for schedules that are not CRF. Options A are types of intermittent schedules. For teaching a new behavior, make sure they get the reward every time at first. Question 40. A BCBA is conducting a free operant preference assessment. Which of the following best describes this method? A. Presenting items in pairs and having the client choose one. B. Allowing the client unrestricted access to a variety of items and observing which ones they interact with and for how long. C. Asking the client to verbally state what items they like the most. D. Presenting one item at a time and recording whether the client approaches it. Answer: B. Allowing the client unrestricted access to a variety of items and observing which ones they interact with and for how long. This question is about specific types of preference assessments used to identify potential reinforcers. A free operant preference assessment involves simply putting out a variety of potential reinforcers and letting the person freely interact with them. The BCBA observes which items the person chooses to spend time with and how much time they spend with each, without any demands or forced choices. Option A describes paired stimulus. Option C describes asking, which is a form of indirect assessment. Option describes single stimulus. Free operant is like setting up a play area and just watching to see what they gravitate towards. Question 41. The ethical guideline regarding responsibility to clients includes which of the following? A. Prioritizing the client's best interests. B. Accepting all clients who seek services. C. Guaranteed outcomes for all interventions. D. Sharing client information freely with other professionals. Answer: A. Prioritizing the client's best interests. This question relates to the ethical responsibilities of a behavior analyst towards their clients. A core principle in any helping profession, and specifically in ABA, is acting in the best interests of the client. This means making decisions and designing interventions that are centered around what is most beneficial and safe for the individual receiving services. Option B is incorrect. You only accept clients you are competent to serve. Option C is impossible and unethical to guarantee outcomes. Option D is the opposite of ethical practice. Client information is confidential and shared only with necessary consent. The client's well-being is always the top priority. Question 42. A behavior reduction plan involves removing attention when a child engages in whining. The BCBA is implementing which procedure? A. Positive reinforcement. B. Positive punishment. C. Negative reinforcement. D. Extinction. Answer: D. Extinction. This question describes a procedure designed to decrease behavior by removing something. The key is identifying what is being removed and why the behavior is happening. The scenario states that attention is being removed when the child whines, and the implied purpose is to decrease whining. Since attention was likely the reinforcer maintaining the whining, though not explicitly stated, it's a common function for whining. Removing that attention is the definition of extinction for an attention-maintained behavior. Positive reinforcement adds something to increase behavior. Positive punishment adds something aversive to decrease behavior. Negative reinforcement removes something aversive to increase behavior. Removing the suspected payoff for the behavior is extinction. Question 43. The dimension of behavior that refers to the time between the presentation of a stimulus and the initiation of a response is called A. Duration. B. Frequency. C. Latency. D. Interresponse time, IRT. Answer C. Latency. This question asks about the time it takes for a behavior to start after a specific cue or event. Latency is the measure of the time from when a stimulus, like a direction or question, is presented until the behavior begins. Duration is how long the behavior lasts. Frequency is how many times it happens. Interresponse time, IRT, is the time between two consecutive instances of the same behavior. If you say, touch your nose, and measure how long it takes the child to start touching their nose, that's latency. Latency is the wait time before the behavior starts. Question 44. Which type of graph is most commonly used in ABA to display the repeated measurement of a behavior over time? A. Bar graph. B. Pie chart. C. Line graph. D. Histogram. Answer C. Line graph. This question asks about the standard visual representation of data in ABA. Line graphs, specifically cumulative records or standard acceleration charts, which are variations of line graphs, are the most common type of graph used in ABA because they clearly show how a behavior changes over time with repeated measurement. The x-axis typically represents time, sessions, days, weeks, and the y-axis represents the measure of the behavior, frequency, duration, percentage, etc. Bar graphs compare discrete data points or categories. Pie charts show parts of a whole. Histograms show distribution. A line graph is ideal for showing progress or change across sessions. Question 45. A contingency contract is a written agreement between individuals that specifies A. The ethical guidelines for behavior analysts. B. How behavior will be measured and graphed. C. The target behavior, the consequences for performing or not performing the behavior, and the criterion for reinforcement. D. The potential functions of a challenging behavior. Answer C. The target behavior, the consequences for performing or not performing the behavior, and the criterion for reinforcement. This question defines a contingency contract. This is a document that outlines the agreement between parties, like a therapist and client or parent and childee, about what specific behavior is expected, the target behavior, what the reward or consequence will be if the behavior occurs or doesn't occur, the consequences, and how much or how often the behavior needs to happen to earn the reward, the criterion. It makes the if-then statement of the contingency explicit and agreed upon. It's like a formal written deal about behavior and its payoff. Question 46. Which term refers to a stimulus that, when removed following a behavior, increases the future probability of that behavior? A. Positive reinforcer. B. Negative reinforcer. C. Positive punisher. D. Negative punisher. Answer B. Negative reinforcer. This question describes negative reinforcement. Reinforcement always increases the future probability of a behavior. Negative means something is removed. So, negative reinforcement is when a behavior occurs and something aversive or unpleasant is removed, and because of that, the behavior is more likely to happen again in the future. For example, taking aspirin, behavior removes a headache, aversive stimulus, making you more likely to take aspirin next time you have a headache. Positive reinforcement adds something desirable. Positive punishment adds something aversive to decrease behavior. Negative punishment removes something desirable to decrease behavior. Remember, negative reinforcement takes away something bad to make a behavior happen more. Question 47. A BCBA is conducting a functional communication training, FCT, procedure. The goal of FCT is to teach the client A. To imitate words, B. An alternative behavior that serves the same function as the challenging behavior, C. To identify pictures of objects, D. To engage in conversation. Answer B. An alternative behavior that serves the same function as the challenging behavior. This question asks about functional communication training, FCT. FCT is a specific intervention based on the FBA results. It involves identifying the function of a challenging behavior, like yelling for attention, and then teaching the client a more appropriate way to get the same consequence, like using words or a picture card to ask for attention. The new communication behavior serves the same function as the old challenging behavior. Option A is echoic training. Option C is tact or listener responding. Option D is intraverbal training or conversational skills. FCT is all about giving the person a better, more acceptable way to communicate their need or want instead of using challenging behavior. Question 48. Which ethical principle emphasizes accuracy and honesty in the field of behavior analysis? A. Beneficence. B. Fidelity. C. Integrity. D. Justice. Answer C. Integrity. This question asks about the ethical principle related to truthfulness and honesty. The principle of integrity in the BACB Ethics Code emphasizes being truthful, honest, and promoting accuracy in all aspects of your professional work. Beneficence is maximizing benefit and minimizing harm. Fidelity is not a primary principle name in the BACB Code. Justice relates to fairness and non-discrimination. Acting with integrity means being straightforward and honest in your assessments, interventions, and interactions. Question 49. A conditioned generalized reinforcer is a stimulus that A. Is naturally reinforcing without prior learning, example, foodie. B. Has been paired with a single primary reinforcer. C. Has been paired with many different primary and secondary reinforcers. D. Signals that reinforcement is available for a specific behavior. Answer C. Has been paired with many different primary and secondary reinforcers. This question defines a conditioned generalized reinforcer, CGR. A CGR is a type of conditioned reinforcer that has become effective because it has been associated with many different reinforcers, both primary, like foodie, and other conditioned reinforcers, like praise, activities. Money is a classic example. It's not naturally reinforcing, but it has been paired with getting food, shelter, fun activities, etc., making it powerfully reinforcing across many situations. Option A describes a primary reinforcer. Option B describes a simple conditioned reinforcer paired with one other reinforcer. Option describes a discriminative stimulus, SD. CGRs are powerful because they unlock access to lots of different good things. Question 50. When graphing data, the x-axis typically represents A. The behavior being measured. B. The value of the behavior measurement. C. Time or sessions. D. The type of intervention. Answer C. Time or sessions. This question asks what the horizontal axis on a typical ABA graph represents. The x-axis, the horizontal one, in a time series graph like those used in ABA, consistently represents the passage of time or the sequence of observation periods or sessions. This allows you to see how the behavior changes over time or across different therapy sessions. The y-axis, vertical, represents the measure of the behavior, frequency, duration, etc. The behavior itself and the type of intervention are variables, but their change over time is plotted using the axis. The x-axis is always about the passage of time in ABA graphs. Question 51. Which procedure involves reinforcing a behavior that is incompatible with the challenging behavior? A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of alternative behavior, DR. C. Differential reinforcement of incompatible behavior, DRI. D. Differential reinforcement of low rates, DRL. Answer: C. Differential reinforcement of incompatible behavior, DRI. This question describes differential reinforcement of incompatible behavior, DRI. DRI is a specific type of differential reinforcement where you reinforce a behavior that cannot happen at the same time as the challenging behavior. For example, reinforcing hands in pockets, incompatible, to decrease hitting, challenging. DRI reinforces an alternative behavior that may or may not be incompatible. Example, reinforcing asking for a break to decrease yelling for escape. DRO reinforces the absence of the challenging behavior for a period of time. DRL reinforces the behavior only if it occurs at a low rate. DRI is about choosing a replacement behavior that physically prevents the challenging one from happening. Question 52. A behavior analyst determines that a client's self-injurious behavior is maintained by the attention they receive from staff when it occurs. Based on this FBA, which extinction procedure should be implemented? A. Withholding tangible items when the behavior occurs. B. Briefly removing the client from the environment when the behavior occurs. C. Providing attention contingent on the absence of the behavior. D. Withholding attention when behavior occurs. Answer: D. Withholding attention when the behavior occurs. This question requires applying the concept of extinction based on function. The FBA determined the behavior is maintained by attention. For extinction to be effective, you must withhold the specific reinforcer that is maintaining the behavior. Therefore, to extinguish an attention-maintained behavior, you stop providing attention when the behavior occurs. Option A targets tangibles, wrong function. Option B is timeout, a punishment procedure, not extinction. Option C is DRO, differential reinforcement, not extinction, directly targeting the challenging behavior. To extinguish attention-maintained behavior, you block the attention. Question 53. The process of gradually reducing the level of assistance or cueing provided to a learner as they become more independent is called: A. Shaping. B. Chaining. C. Fading. D. Prompting. Answer: C. Fading. This question asks about gradually lessening the help given to a learner. Fading is the procedure where you systematically reduce the strength, intensity, or intrusiveness of a prompt as the learner's behavior comes under the control of the natural discriminative stimulus. For example, if you initially used full physical prompts to teach hand washing, fading would involve moving to partial physical, then gestural, then maybe just a verbal prompt, until the learner washes their hands when they see the sink, the natural SD, without any help. Shaping is for new behaviors. Chaining links steps. Prompting is giving the initial help. Fading is taking the help away slowly. Think of fading prompts like taking away the scaffolding from a building. Question 54. Which of the following is a key component of informed consent? A. The client agrees to all recommended interventions without question. B. The client is fully informed about the proposed treatment, its risks, benefits, and alternatives, and agrees voluntarily. C. The consent is obtained only from the client's legal guardian. D. Consent is only required for high-risk procedures. Answer: B. The client is fully informed about the proposed treatment, its risks, benefits, and alternatives, and agrees voluntarily. This question is about the ethical requirement of informed consent. For consent to be truly informed, the person giving consent, or their legal guardian if they are unable to consent, must be given all relevant information about the proposed services, including what will be done, why, potential positive and negative outcomes, and other options available. Consent must be given voluntarily, without coercion. Option A is incorrect. Questioning is encouraged. Option C is too restrictive. Competent adults can consent for themselves. Option D is incorrect. Consent is required for services. Informed consent is about making sure the client, or guardian, understands and agrees freely to the plan. Question 55. Which measure of behavior records the number of times a behavior occurs within a specific time period? A. Duration. B. Frequency. C. Rate. D. Latency. Answer C. Rate. This question asks about counting behavior occurrences specifically in relation to time. While frequency is the count of occurrences, rate is the count per unit of time. Example, instances per minute, per hour, per session. Rate is a more standard measure in ABA because it allows for comparison across observation periods of different lengths. Frequency is a simple count, but rate adds the time component. Duration is length of time. Latency is time to start. Rate tells you how often it happens within a certain amount of time. Question 56. A behavior analyst implements a procedure where a child earns a sticker for every 3 correct responses on a learning task. This is an example of which type of reinforcement schedule? A. Fixed interval, FIFO. B. Variable interval, VI. C. Fixed ratio, FR. D. Variable ratio, VR. Answer C. Fixed ratio, FR. This question describes a reinforcement schedule based on the number of responses, since the child earns a sticker after a fixed specific number of responses. 3. It is a fixed ratio, FR, schedule. Fixed means the number of responses is constant, and ratio means it's based on the number of responses. Interval schedules, phi, VI, are based on time passing, not the number of responses. Variable ratio would mean the number of responses required changes unpredictably. FR schedules are based on a set number of completed tasks. Question 57. When teaching a new behavior chain, teaching the first step, then the second step, while still prompting the first, and so on, is characteristic of A. Total task presentation. B. Backward chaining. C. Forward chaining. D. Shaping. Answer C. Forward chaining. This question asks about a specific method of teaching a chain of behaviors. Forward chaining involves teaching the steps of a task analysis in their natural order, starting with the first step. The learner masters the first step, then learns the second step while still doing the first, and so on, until the entire chain is mastered. Backward chaining starts with the last step. Total task presentation teaches all steps simultaneously with prompts as needed. Shaping is for teaching a single behavior, not a sequence of steps. Forward chaining builds the chain from the beginning to the end. Question 58. A BCBA determines that a client's disruptive behavior is maintained by an escape from academic tasks. Which function-based intervention strategy focuses on making the task less aversive? A. Implementing a token economy for completing tasks. B. Providing frequent breaks during tasks. C. Teaching the client to ask for a break, FCT. D. Modifying the task difficulty or presentation. Answer D. Modifying the task difficulty or presentation. The function of the behavior is escape from difficult tasks, while options B and C are valid interventions, often used with escape-maintained behavior. The question asks for a strategy that makes the task itself less aversive. Modifying the task, making it easier, shorter, more engaging, presented differently, directly addresses the antecedent that makes escape reinforcing. A token economy, A, provides reinforcement for completion but doesn't change the task itself, providing breaks. B, and teaching requesting breaks. C, are strategies for allowing escape or teaching an appropriate escape, but they don't change how aversive the task feels. Making the task itself less unpleasant can reduce the motivation to escape it. Sometimes, changing the task is the best solution. Question 59. Which type of graph is useful for displaying the total number of responses over time, where the line can only stay flat or increase? A. Line graph. B. Bar graph. C. Cumulative record. D. Scatter plot. Answer C. Cumulative record. This question describes a cumulative record. A cumulative record is a specific type of line graph where the total number of responses recorded accumulates over time. The line always starts at 0 and can only go up or stay flat. If no responses occur, it never goes down because it represents the total count. This type of graph is particularly useful for showing rate of response. Steeper slopes mean higher rates, and for visualizing changes in rate. A regular line graph can go up or down depending on the measure. Bar graphs compare totals across categories. Scatter plots show the relationship between two variables. Cumulative records pile up the responses over time. Question 60. A client refuses to eat vegetables. The BCBA decides to pair small bites of vegetables with access to a highly preferred dessert. This is an example of A. Punishment. B. Extinction. C. Pairing. D. Response cost. Answer. C. Pairing. This question describes the process of pairing. Pairing occurs when a neutral stimulus, or something aversive, like vegetables might be for this client, is repeatedly presented at the same time as, or immediately before, a known reinforcer, the preferred dessert. The goal is for the neutral stimulus to become associated with the reinforcer, and thus become more preferred itself or less aversive. This is a classical conditioning principle used to make less preferred items or activities more enjoyable. Punishment and response cost decrease behavior. Extinction removes reinforcement. Pairing is about making something less desirable become more desirable by linking it with something good. Question 61. The ethical principle that requires behavior analysts to take steps to avoid harming clients and to minimize harm when it is unavoidable is A. Integrity. B. Justice. C. Beneficence. D. Responsibility. Answer. C. Beneficence. This question asks about the ethical principle focused on welfare and safety. The principle of beneficence emphasizes working for the benefit of others and taking precautions to avoid causing harm, often stated as do no harm, while other principles like responsibility and integrity contribute to this. Beneficence is the one most directly related to maximizing positive outcomes and minimizing negative ones for the client. Justice is about fairness. Integrity is about honesty. Beneficence is about doing good and preventing harm. Question 62. A client engages in headbanging. An FBA indicates this behavior is maintained by the sensory stimulation it provides. This is an example of which function? A. Attention. B. Tangible. C. Escape. D. Automatic. Answer. D. Automatic. This question asks about the function of a behavior that is internally reinforcing. The FBA indicates the behavior is maintained by the sensory stimulation it provides. This means the consequence is happening within the individual's body or nervous system, not provided by the external environment or other people. This is the definition of an automatic function. The behavior is reinforced by its own sensory or physiological consequences. Attention, tangible, and escape functions all involve consequences provided by the external environment or other people. If the behavior feels good or provides stimulation to the person doing it, think automatic. Question 63. When collecting data using partial interval recording, the behavior is recorded as occurring if it happens. A. Throughout the entire interval. B. At the very end of the interval. C. At any point during the interval. D. At the very beginning of the interval. Answer. C. At any point during the interval. This question asks for the specific rule for recording in partial interval recording. With partial interval recording, you divide the observation time into intervals and simply record a yes or check mark if the target behavior occurs at any time during that interval, even if it's just for a moment. Whole interval recording requires the behavior to occur throughout the entire interval. Momentary time sampling records if the behavior occurs at the very end of the interval. Partial interval recording is typically used for behaviors you want to decrease, and it tends to overestimate the occurrence of the behavior. If it happens at all during the slice of time, you mark it down. Question 64. Aversive control refers to interventions based on A. Only positive reinforcement. B. The principles of punishment and negative reinforcement. C. Pairing neutral stimuli with preferred stimuli. D. Withholding reinforcement for previously reinforced behavior. Answer: B. The principles of punishment and negative reinforcement. This question asks about aversive control. This term refers to using procedures that involve aversive stimuli, unpleasant things or events, to influence behavior. This includes punishment, adding an aversive stimulus or removing a preferred one to decrease behavior, and negative reinforcement, removing an aversive stimulus to increase behavior. While these procedures can be effective, they raise ethical considerations and require careful implementation. Positive reinforcement uses pleasant stimuli to increase behavior. Pairing relates to classical conditioning. Withholding reinforcement is extinction. Aversive control involves consequences that are unpleasant in some way. Question 65. Stimulus control occurs when A. A behavior is consistently reinforced in the presence of a specific stimulus and not in its absence. B. A behavior occurs regardless of the presence or absence of any specific stimulus. C. A behavior is performed in response to a wide range of dissimilar stimuli. D. A behavior is decreased through the removal of a stimulus. Answer: A. A behavior is consistently reinforced in the presence of a specific stimulus and not in its absence. This question defines stimulus control. Stimulus control happens when a behavior is more likely to occur in the presence of a specific stimulus, an SD, than in its absence, an S delta or S, because the behavior has been reinforced only when that specific stimulus is present. The stimulus controls the behavior because it signals whether the behavior will pay off. Option B describes behavior that is not under stimulus control. Option C describes stimulus generalization, responding to similar stimuli. Option describes negative punishment or response cost. Stimulus control means the environment signals when the behavior will work to get the reward. Question 66. A BCBA implements a behavior plan that includes specific steps for staff to follow if a client becomes aggressive. These steps are part of A. Skill acquisition plan. B. Functional behavior assessment. C. Crisis management plan. D. Preference assessment. Answer: C. Crisis management plan. This question describes a plan for responding to dangerous or escalated behaviors. A crisis management plan, also sometimes called an emergency or safety plan, is a document that outlines specific procedures to follow when a client engages in behaviors that pose a risk of harm to themselves or others, such as aggression. These plans focus on de-escalation, safety, and ensuring everyone knows how to respond consistently in an emergency. A skill acquisition plan teaches new skills. An FBA determines why behavior occurs. A preference assessment finds reinforcers. A crisis plan is for when things get unsafe. Question 67. Which of the following is the best example of measuring behavior using permanent product? A. Counting the number of times a student talks out in class. B. Recording the total time a client engages in appropriate play. C. Counting the number of completed math problems on a worksheet. D. Marking on a data sheet whether a behavior occurred during an interval. Answer: C. Counting the number of completed math problems on a worksheet. This question asks for an example of permanent product measurement. Permanent product measurement involves measuring the result or outcome of a behavior after the behavior has occurred. You measure the evidence the behavior left behind. Option C involves counting the finished problems on a worksheet, which is a tangible outcome left after the student completed the math behavior. Options A and B require observing the behavior as it is happening. Option D is an example of interval recording, also requiring observation during the behavior. If you can count the evidence after the behavior is done, it's permanent product. Question 68. A BCBA receives a gift from a client's family. According to ethical guidelines, the BCBA should A. Graciously accept the gift regardless of its value. B. Accept the gift if its value is minimal and it's not intended as payment or influence. C. Refuse all gifts from clients or their families. D. Only accept gifts if they are related to ABA therapy materials. Answer B. Accept the gift if its value is minimal and it's not intended as payment or influence. This question is about ethical boundaries regarding gifts. The BACB Ethics Code discourages accepting gifts that are expensive or could be perceived as influencing the professional relationship. However, accepting gifts of minimal value, like a small card or homemade item, typically interpreted as under $10 or $15, depending on agency policy/context, is generally acceptable, provided it's not intended as payment for services or an attempt to gain favor. Refusing all gifts, C, might damage rapport. Accepting regardless of value, A, is unethical. Gifts don't need to be therapy-related, D. The key is minimal value and no appearance of influence. When in doubt, politely decline or check your agency's specific policy. Question 69. The primary benefit of using a variable interval, VI, schedule of reinforcement is that it typically produces A. A high rate of responding. B. Consistent pausing after reinforcement. C. A steady, moderate rate of responding resistant to extinction. D. Rapid acquisition of a new behavior. Answer. C. A steady, moderate rate of responding resistant to extinction. This question asks about the typical pattern of responding under a variable interval, VI, schedule. VI schedules provide reinforcement for the first response after an unpredictable amount of time has passed. Because the reinforcement interval changes unpredictably, the learner doesn't know exactly when the next reinforcement is available, leading to a steady, moderate rate of responding without the pauses seen in VI schedules. Variable schedules are also known for producing behavior that is highly resistant to extinction, meaning the behavior continues for a while even after reinforcement is stopped. High rates are characteristic of ratio schedules. Rapid acquisition is best with CRF. VI schedules are great for maintaining behavior once it's learned. Question 70. Which ethical principle requires behavior analysts to make data-based decisions? A. Beneficence. B. Integrity. C. Professional and ethical behavior. D. Responsible conduct of behavior analysts. Answer. D. Responsible conduct of behavior analysts. This question relates to the core practice standards for behavior analysts. Section 2 of the BACB Ethics Code, titled Responsible Conduct of Behavior Analysts, includes guidelines about relying on scientific knowledge, competence, and specifically states the requirement to make decisions based on data. While making data-based decisions contributes to beneficence, integrity, and professional behavior, the explicit requirement falls under responsible conduct. Using data to guide your work is a fundamental part of being a responsible ABA professional. Question 71. When implementing a discrete trial training, DTT, program, the trial begins with the A. Consequence. B. Reinforcer. C. Discriminative stimulus, SD. D. Response. Answer. C. Discriminative stimulus, SD. This question asks about the typical structure of a discrete trial. A discrete trial has a clear beginning and end, and usually follows a consistent sequence. The therapist presents a discriminative stimulus, SD, like touch red, or showing a picture. The client then makes a response, correct or incorrect. Finally, the therapist delivers a consequence, reinforcement for a correct response or error correction for an incorrect one. The est is the cue that kicks off the trial. The response follows the est, and the consequence follows the response. DTT starts with the instruction or cue. Question 72. Which term refers to a decrease in the frequency of a behavior due to repeated presentations of the stimulus that initially elicited the behavior? A. Extinction. B. Punishment. C. Habituation. D. Satiation. Answer. C. Habituation. This question describes habituation, which is a concept from classical conditioning. Habituation is when the strength or frequency of a reflexive or respondent behavior decreases after the repeated presentation of the stimulus that elicits it. For example, if you hear a loud, unexpected noise, you might startle, reflex. If the noise repeats over and over, your startle response will likely decrease or stop. You habituate to the noise. Extinction involves withholding reinforcement for operant behavior. Punishment adds something aversive or removes something preferred. Satiation occurs when a reinforcer loses its effectiveness due to overuse. Habituation is like getting used to a stimulus. Question 73. A BCBA wants to decrease a client's finger-snapping behavior, which occurs at a high rate. The BCBA decides to reinforce the client if they snap their fingers no more than 5 times per minute. This is an example of A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of alternative behavior. DR. C. Differential reinforcement of incompatible behavior. DRI. D. Differential reinforcement of low rates. DRL. Answer D. Differential reinforcement of low rates. DRL. This question describes a differential reinforcement procedure aimed at reducing, but not necessarily eliminating, a behavior by reinforcing it only when it occurs at a low rate. Differential reinforcement of low rates. DRL is used when the goal is to decrease the frequency of a behavior, but not get rid of it entirely, or when eliminating it immediately is too difficult. The client is reinforced for the behavior occurring at or below a specific low rate. DRO reinforces the absence of the behavior. DRS/DRI reinforce different behaviors. DRL specifically targets reducing the rate of the target behavior. You're teaching them to do it less often, not stop completely. Question 74. Which of the following is a potential disadvantage of using continuous reinforcement, CRF? A. The behavior is highly resistant to extinction. B. Acquisition of the behavior is slow. C. The learner may become satiated on the reinforcer quickly. D. It is difficult to implement consistently. Answer C. The learner may become satiated on the reinforcer quickly. This question asks about a drawback of using CRF. While CRF is great for fast acquisition, B is wrong, and generally easier to implement consistently than some intermittent schedules. D is wrong. A major disadvantage is that the learner receives reinforcement every single time. This means they might quickly get satiated on the reinforcer, meaning they have had too much and it loses its motivating power. Also, behaviors on CRF are not resistant to extinction. Is wrong. If you stop reinforcing a behavior that was reinforced every time, it will stop quickly. Be mindful of satiation when using CRF. Question 75. When writing behavior goals, it is important that they are SMART goals. What does the M in SMART typically stand for? A. Motivating. B. Measurable. C. Meaningful. D. Multiple. Answer B. Measurable. This question relates to setting effective goals, a common task in ABA. The SMART goal framework is often used, and the M stands for measurable. This means the goal is written in a way that you can objectively determine whether or not the goal has been met, usually by quantifying the behavior example will increase hand raising to an average of 5 times per session. Motivating, meaningful, and multiple are not the standard components of the SMART acronym: specific, measurable, achievable, relevant, time-boundy. A good goal needs to be measurable, so you know if you're making progress.